In this video, we'll be reviewing how WD checklists are used to provide comprehensive, life-saving care. The newborn Jane Tomba is sick. Although her mom does not carry any risk factors, she has a history of fever and respiratory distress. On exam, she is febrile. She's not moving. Her skin is mottled. She has subcostal retractions. Listening to her lungs, she has inspiratory and expiratory rhonchi diffusely. You'll notice that as a user has been clicking relevant findings in the checklist at the left, a complete medical note on the right is being written. The WD system allows manual entry of history and physical findings too. For example, in the history of present illness, we can edit one of WD's review of system squares. Let's say that baby Jane has yet to void. We would click on Edit for voiding and note No urine for the day. We remember that Jane is breathing very fast, so she's not drinking. We could note that she is not drinking. We can also add a complaint in the Add Complaint box depicted here. Let's say that Jane has vomited blood twice, but that it's cleared the second time around. Selecting this option, we note moderate vomiting, that it was intermittent, that there was some blood, but we'll note that it cleared the second time around. Whatever the method of observation entry, we see a clear, elegant display of the provider's observations outside of the checklist. We will note that most WD users don't choose to do this, as the checklist findings have been already constructed to be comprehensive. Let's manually enter some physical findings. Let's say Jane's Tomba's liver is big. To record our findings, we only need to go to the abdomen section, find the liver, and note that it's big, specifically by noting how many centimeters below the costal margin. We can add a note, liver consistency normal. Similarly, let's say that Jane's left eye has discharge. We'd go into the eye section, note discharge, and say on the left there was moderate purulent discharge. We could note no conjunctival reddening. Again, we see clear, elegant display of the provider's observations outside of the checklist entry system, though most WD users don't find it necessary to do this. Let's order some tests to pin down the diagnosis. The checklist tells the user that the diagnosis of sepsis is ruled in or out via blood count and blood culture. Let's order these tests. Notice how the orders for the CBC and blood culture are now listed to the right of the screen below the exam section. The orders have been sent also to the patient's nurse and the lab for immediate gathering and analysis of the samples. As results become available, they will appear under the corresponding study for the provider to conveniently see. You'll recall that Jane Tomba is also in respiratory distress, so let's add an X-ray to our list of studies, and let's make this portable. Let's now go to the treatment portion of the checklist. Because of the baby's worrisome physical signs, the checklist suggests the ordering of 2 specific antibiotics at a standardized dose. Note, some facilities may have different preferences or supplies of antibiotics, so WD lists all the evidence-based alternatives. Let's order some ampicillin using WD's facilitated drug ordering system. We select ampicillin. We make sure that it's in stock. and we are brought to a prescription page where the dose of ampicillin has already been calculated according to the patient's weight. The provider can change any of the numbers on the page, but typically there's no need to do this. For additional reference, the provider can read dosing and administration guidelines outlined in blue. Let's administer the first dose of ampicillin. After pressing the Administer button, the order is recorded as pending at that right lower portion of the screen below Studies. Behind the scenes, the order has been simultaneously sent to the pharmacy to prepare the medicine and to the nurse for pickup and administration. Any comment or action to this order will be clearly and conveniently presented to the provider on the exam page, obviating the need for the provider to run through multiple screens or physically chasing down medicines. Let's order gentamicin, the other part of the therapy. We select, but we notice that it's not in stock. The provider therefore selects an alternative, cefotaxime. This drug is in stock. Again, we're brought to a prescription screen where the dose has already been calculated. We administer a dose. Sick babies don't drink. This patient needs the correct type and volume of IV hydration. Again, WD makes life-saving choices easy. The provider selects the option for maintenance fluids, ensures that the dextrose 10% is in stock. It is, and then is brought to the prescription page where the volume of fluids per hour has been calculated based on the baby's weight. Finally, you recall that Jane Tomba is in respiratory distress. She needs respiratory support. For this, we go to the Continuous Positive Airway Pressure Checklist. We add this checklist to the Add Checklist box below the first checklist, and we select. We'll explore the CPAP option in a different instructional video. Still, we should be proud of ourselves. The care of the baby up to this point has been excellent. We note this objectively from WD's quality care assurance rectangles that remain red if diagnostic, treatment, or patient education standards have not been met. By entering the diagnosis square, we see that the neonatal danger signs of tachypnea warranted the appropriate tests. By entering the treatment rectangle, we see that, again, the danger signs necessitated ampicillin and gram-negative antibiotic coverage. There's only one thing left to do, patient education. We see that the provider needs to explain the findings and clinical course to the family and answer patient family questions and reassure them. Doing this turns the quality rectangle green for patient education. In conclusion, WD checklists support providers at critical observation and treatment points. This saves time and takes away guesswork when providers are fatigued or stressed.